Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
After properly arranging the maxillary anterior teeth to one side of the midline, we are now ready to set the mandibular anterior teeth. The mandibular wax occlusal bite rim has been reduced from the midline to the first bicuspid area in order to accommodate the anterior teeth. This wax removal permits proper alignment and positioning of the anterior teeth. The posterior wax bite rim is left intact to maintain the proper occlusal vertical dimension. After placing a small amount of molten pink baseplate wax with the number 7 wax spatula, the mandibular central incisor is positioned. The tooth is placed with the incisal edge even with the mandibular bite rim and with the neck of the tooth inclined toward the labial part of the residual ridge. The facial surface of the tooth is tipped slightly to the labial, thus maintaining the continuity developed by the mandibular wax bite rim. In this technique procedure, we're striving for a vertical overlap of 1 millimeter and a horizontal overlap of 2 millimeters. Horizontal overlap is defined as the antero-posterior relationship of the incisal edges. Vertical overlap is the superior-inferior relationship of the incisal edges. The mandibular lateral incisor and cuspid are now set. Notice that the lateral incisor is positioned with the incisal edge even with the central incisor. The labial surface of the tooth maintains the continuity of the mandibular occlusal rim, and the long axis of the tooth is such that the neck is slightly to the distal. The mandibular cuspid is set with the cusp tip slightly higher than the lateral and central incisor, with the neck prominent and tipped slightly to the distal. The horizontal and vertical overlap is maintained. The maxillary lateral incisor was placed 1 millimeter above the occlusal bite rim. Thus, the vertical overlap in the central incisor area is 0. From the incisal edge, the mandibular cuspid has a mesial and distal incline. The mesial incline is harmonious with anterior curve developed by the lateral and central incisors. The distal incline is directed posteriorly. In review, the maxillary and mandibular incisors have been arranged on one side of the midline with the desired incisal relationship of 1 millimeter of vertical overlap and 2 millimeters of horizontal overlap. After properly setting one side, the opposite side can be arranged. The maxillary and mandibular 12 anterior teeth have now been set according to the previously stated requirements. The incisal pin has been removed for demonstration only and should not be removed arbitrarily when setting the teeth. The condylar mechanisms have been locked during the setting of the anterior teeth.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.